This is what. Yeah. Good morning, everybody, and welcome to the health fair at our RS Maj annual meeting. So, this is echoing from him. तो क्या कर माइक्रोफोन ये इसका वॉल्यूम बंद कर कब माइक्रोफोन माइक्रोफोन हेलो आई थिंक दैट का इसमें वापस दैट्स फाइन हेलो अब नहीं आया no he says doesn't need it okay because the whole thing is it is going on. So, couple of announcements. Yeah, just use the mic. So anybody who needs a 101 session, so please register outside. So whether it is for mental health or for cardiology or for allergy, food allergies or anything. So he's sharing it. Rahul. Okay. Okay, so you can all hear me. So again, I welcome you all. Thank you for coming to the health fair. We are very privileged to have a very good number of talks today, and most importantly, we have good panelists. And so after this presentation, there will be a group of panelists, so we will have a question and answer session. And this will be followed by two other presentations. So I'll start with the first presentation, so not to delay further. This is on food is medicine. So kitchen is your work, kitchen is your pharmacy, and food is the medicine. So the whole theme. Slides are not moving. I think it will not move on this.
It will move. I get my glasses. Once activated, हो जाएगा ना?
Okay. So for ages, we have been told that food is medicine, and food should be the first medicine we should always think of. In general, even though this concept is not as old as Hippocrates, in Ayurveda more than 5,000 years ago, this whole concept of healing your body with the right food already existed. So it is said that when food is wrong, medicine is of no use. And when food is right, medicine is of no need. The old saying from Ayurveda was that anything we do to our body our aim should be to prolong life, promote perfect health, and maintain good health in an already healthy individual. So
I'm going to slides to yourself. नहीं ये सब हाइड कर रहा है ना. Get down.
it's okay.
वो सामने दिखता नहीं है ना सब लोगों. Move it down also. There we go. Okay.
So the reason why we really want to talk about is that if we look at most common diseases that actually affect us, whether it is our quality of life or whether it is the longevity, and the top on the list are heart and vascular diseases, cancer, stroke, lung diseases, accidents, almost and diabetes. So all of these are connected in one way or other, almost 80 to 90% of them, to a lifestyle. So if we follow a healthy lifestyle, slide. If we follow a healthy lifestyle, we can, to a large extent, take care of these problems. And like I said, 80% of these problems are related to lifestyle. In the lifestyle medicine, in integrated medicine, in Ayurveda, and in most of the different type of medicines, the biggest teaching is in order to restore health, is to have a good plant-based diet, predominantly plant-based diet, do exercise on a daily basis, have a good restful sleep, and try to have relaxation, avoid stress, and avoid all risky substances like smoking or other drugs, and social connections. So something that we are doing today, connect to people, connect to your own family, so to maintain a good mental health. Specifically, this applies more to our Indian population, that 60% of the heart disease rests in India, even though we are less than 20% population of the world. And today, India is the diabetes capital of the world. Even though Indians don't have that much of obesity, that much of high cholesterol, that much of smoking behavior, but still in our subcontinent, heart disease, it's happening in a very younger age, and it becomes untreatable in a big number of patients. As compared to other people, to the Caucasians, we are like almost 4 times as high risk and 20 times higher than the Japanese. So in one of the, my goal is not to bring up medical studies, but this is one thing I wanted to point out today here, is that when it was looked into 52 countries on how people present with their first heart attack, it was found out that there are around 9 major risk factors. Of these, simple 5 risk factors contribute 80%. So all of these risk factors are related to lifestyle. So it makes all the sense to think about improving lifestyle. When it comes to following a good lifestyle, it is good to follow something that is evidence-based. The YouTube, the internet, the literature, everywhere, there is a lot of things available now in this age. But what is good, what is right, what is the best thing to do? It is good to see what has been already studied. So lifestyle medicine basically is a evidence-based therapeutic approach to life. And it has 6 pillars. One of the pillar is, which is the most important, is the diet, which includes a whole food, predominantly plant-based, and doesn't mean vegan, but predominantly plant-based diet, a regular, active, physically active life with a good sleep, stress management, avoiding risky substances like smoking, and developing positive connections. So these are the 6 pillars of health. I will be focusing mostly on diet today. That is the topic of the day today. But if you look at it, it has been very well published and accepted, and that if we change lifestyle, it works wonders. It works better than taking a medication for pre-diabetes in order to prevent diabetes. And pre-diabetes today is very, very common. Almost 40 to 45% of people are pre-diabetes. 80 to 90% of them, they don't even know about it. And more than 50% are not even obese. So it's very important to know that this is a big risk factor. Now, so simple, there is like a multiple diet protocols. They have been either restricts a particular type of food or a particular duration of food or a calorie restriction. So these type of diets have always had some sort of calorie restriction. There is a big reason why they don't work is because it comes with the word restriction. There's nothing positive in it. What it means is that we tend to focus more on things like, oh, this is the weight, this is the calories, this is this thing, and this is I'm only going to do for 6 weeks or 12 weeks. So continuity becomes a problem. So there's enough data that most of these diets, particularly the high-end keto diets, paleo diets, they don't work in the long run just because that's not a normal way of life. Even when we compare the most evidence-based diets, which includes like the DASH diet or Mediterranean diet, or the low-fat, predominantly plant-based diet, it is not easy to sustain. So how do we sustain a good dietary pattern is to just change our thought process. So we have to understand that having a good lifestyle is a mindset. It's a lifelong journey. It's not like a 6 weeks or 12 weeks program that we go through, but it is something we have to put it in our habit. It's culture of doing it. So consider it like a lifelong journey of doing the right things. And with the basic goal is that we are not doing any calorie counting. We are not doing any complicated formulas of protein, fat, and percentage fat and all that stuff. Or we are not forcing any dietary change. We are not focusing on anything that's boring and it cannot be continued for lifelong. So it has to be something that can work with our life. So the big question is then what to do, what to eat, and how do we convert our kitchen, our lifestyle into a healthy one. So one of the big thing is, as per the American College of Lifestyle Medicine, and which is evidence-based, is that we need to consider the word whole, the whole package. So whenever we focus on any problem, we should consider as the whole package. So somebody who has the problem, is important to know, instead of knowing that, oh, let me focus on diabetes and treat with insulin or something, but to try to see why we actually get there. More important than doing what we can do today. Instead of that, we should focus on whole. So when it comes to food, eating a whole food with instead of focusing on micronutrients or part of the food, and trying to base the diet mostly on a plant-based diet, and trying to eat a variety of food should be the pattern that we should follow. So what is an ideal food? I mean, in today's world, since we know that the biggest problem is cardiometabolic, so everything relates to our lifestyle. As compared to, I would say, 100 years ago, these diseases were not even known just because the lifestyle was right. But people used to die because of infection and all. But today, everything is lifestyle related. If we think about in simple terms what a normal food should be, it should be something that fills our appetite. So a feeling of fullness should be there, and one should feel happy about it. And that feeling can come from a junk food, or it can come from a good food. But whatever we eat should be something that should not be restricted. It should be a full plate. And then if we eat something, it should be able to trap the extra calories. It should not be calorie dense. It should be less in calories, but at the same time fulfilling. But even if you eat something calorie dense, it should be able to trap it. Then the third thing is your food should not slow down the metabolism. And that's one of the biggest thing about eating the current food, which we usually call the standard American diet, or SAD, which is SAD diet, is that almost all of it, whether it is the energy drinks or the soda or the high-end condensed foods, they basically slow down the metabolism. So if there is a food that speeds up your metabolism, that should be the ideal food. So what is that? If you look at our diet in general, and this is, I'm talking in general of what it consumes, what we consume, overconsume, as according to WHO, is that these 7 things we always overconsume, which includes added sugars, which is there almost everywhere. They're even adding it in water now. So more fat, more salt, trans fats, which has been declared a carcinogen by the WHO, but it's still being used, and ultra processed grains. So it's almost a part of our life now. Whether you are eating a donut or a pizza or whatever, fries, it's all ultra processed grains. And then the food that is high in calories. So it's a big list, whether it includes the red meat or poultry or eggs or confectionaries. All of them have the same characteristics. They slow down the metabolism, they're dense in calories, and they promote more appetite instead of suppressing our appetite. So it's well designed for the food industry, but not for our longevity. Now, it is important that we understand that some of the foods are completely a restriction, and most of them, one of them is trans fat. So we should look for it and not use it. So what is the irony is that despite all these things that we do, there is a lot of things which is required, which are the micronutrients, is still missing in the diet. So the whole idea of diet should be, again, something that includes the whole package, does not slow down the metabolism, fulfills the appetite, and traps the calories. So what is that 5? The Wonder diet, that for that is actually something that's rich in fiber. So this is probably the most important word in the last 5-10 years, and is that eating a whole grain, predominantly plant-based diet, which has mostly fiber, is the answer to all these things. So if we compare to the condensed calories in a fat, 1 gram of fat has like 9 calories, as compared to fiber is 0 to 2 calories only. So the common foods which are high in fiber are the vegetables, fruits, legumes, and comparatively the oil and fat has more than almost 8 to 10 times the calories. So the calorie intake is low in the fiber diet. So when we fill our stomach with 500 calories, we just need like 2 teaspoons of butter. And comparatively, if you're eating a predominantly plant-based diet, you may not be able to fill your stomach with 500 calories. So what happens when your food is full of calories, full of fiber, is that it does multiple things to us. So one of the most important things that it does is when the stomach is full, it sends a signal to the brain that I am satisfied now. So, and I'm happy, the brain is happy that the food, the stomach is full. Secondly, it decreases the gastric emptying time, which means that the stomach, which was basically making if it was glucose or fat, it was immediately absorbed. It's not going to get absorbed. The whatever you eat with the fiber, with the, say for example, with the salad, or that also is being trapped, and then it all the thing does not get absorbed and goes to the large gut. Where it goes to the large gut, we have a whole colony of bacteria, and the number is more than our own genes. So you can imagine how many bacteria we have in our body that are healthy. They're looking for the right type of food. And then the bacteria is actually eating that food, and it's producing the positive factors which are required to improve the metabolism, to fasten the metabolism, to decrease the gluconeogenesis, to decrease the insulin, hyperinsulinemia, which comes with metabolism, and improve the, again, giving a signal to the brain, improving the satiety. Not only that, it is also improves the cholesterol, improves the triglyceride. It also improves the mood, because these bacteria, they release multiple factors, which are the neurohormonal factors that improves the mood, improves the sleep. So pretty much something that we really need. So another role of fiber in the diet is that when you take fiber in the diet, and it releases some factors, and one of the factors which is like the hype these days in the last 4 or 5 years, if you look at the stocks of one of these medications, that it has skyrocketed just because of this one factor, which is called glycogen-like peptide A1. So any medication that increases this level in the body is melting the patients who are obese in a way that the bariatric surgery, all of those lines have gone out. So this is the most important medication in the cardiometabolic world now, which is the GLP-1 inhibitors, commonly known as that. Even for people who do not have diabetes, even for people who do not have pre-diabetes, even though for those who are not even obese, it's still helping them if they have a major condition like acute heart attack, if they have condition life-threatening like heart failure. So these medications are helping people live longer. And it is a new surprise. This is something that we did not know, I will say 10 years ago, but it has became important to our knowledge in the last 5 years, to the extent that this is the number one in all the guidelines which are endorsed by the American Diabetes Association or American Heart Association, all the societies, that this should be used in all patients. But if you think about it, when you eat a fiber diet, it is doing the same thing. It releases these GLP-like agonists in a very high number, and it is all well studied, and it's something not new, but now we are trying to figure out how a fiber diet is actually doing the same thing that these medications are doing. So there is no reason who strictly follow a diet which is predominantly fiber, predominantly plant-based, because animal protein does not have any fiber. So most fiber high-rich diets are low in calories and they don't have fat. So the second role that this plays is that the fiber actually traps the calories that you take along with it. So say, for example, your plate is full of 75% fiber and you eat a sweet like a jalebi or like a donut or anything with it. So the fiber actually traps the calorie, does not get absorbed, and you simply can flush those calories, extra calories that you have eaten. So essentially it fulfills the whole agenda, is that you can eat what you like to eat so long as you eat fiber first. So the same thing about how it is boosting metabolism, decreasing your, increasing your satiety. In fact, today the food can be simply divided into their based on their satiety index. So what food increases the satiety more versus what food does not increase the satiety. So it is all something, there's nothing new. This is all we have always been told from our grandparents, that eat more salad, eat more vegetarian food, eat more legumes and whole grains. But this is what the science is discovering now. So nothing new that I'm telling. So when it comes to fiber, it is important to understand where does this fiber come from. So there are 5 categories of the foods that actually gives you fiber. So top of the list is the green leafy vegetables, basically vegetables of any kind, but there are some vegetables which has high fiber and there's some vegetable which has less fiber. Similarly, there are fruits. Most fruits are rich in fiber. But there are some fruits which has very less fiber, but more fructose, but other fruits that are more fiber and less fructose. So knowing that part that part of knowledge is important to see what food has more fiber. Same thing, our common food, which is the legumes, the dals of different types, the beans, the black gram, and then there are at least 50 different type of legumes that we know of today. All of them are rich in fiber, easily digestible protein. They have multiple positive antioxidants that we need. And if we eating a whole grain diet full of fiber with a limited amount of nuts and seeds, technically we are fulfilling all the micronutrient need. So what happens after you eat a diet, which is a whole package of these 5 different type of foods, you don't have to really worry about what is my vitamin C, vitamin B, and all that stuff. To a large extent, you don't have to think about it because it's coming naturally from the food. Same thing is when you have to think about simple concept is eating a juice is no more considered healthy by any of the American Diabetes Association or any organization. In fact, this is something that we discourage patients to do it because it's condensed calories. Same thing can be obtained from eating the whole apple, but it comes with fiber and the positive factors. So that's the difference. And the same thing applies to if you're eating a potato. So whole potato, much better than eating fries, which has everything, trans fats, saturated fats, and microprocessed elements. So what is a whole grain? A whole grain basically is the ancient grains that our ancestors were used to eat. It is basically the grain with this husk. So with the brown layer, which contains all the minerals, vitamins, and the proteins. And when the milling started somewhere after the Industrial Revolution, the first thing that went out of our good quality food was that they started doing more and more of food milling. So it used to remove the outer layer, which we still we kept on refining. And one of the major reasons why they were doing it is because it can be preserved for a longer time. But at the same time, people got used to that taste and they enjoy that taste. And now nobody wants to go to the original taste. Then if you're eating the food thinking of food in a different way, that, oh, okay, I'm going to eat a whole rainbow of food this week. So trying to bring colors to the food, to trying to see that if you're taking the white and the greens and the purples and everything, so they have all the positive antioxidants and anthocyanins, and there are multiple of factors. In fact, to the extent that a lot of them we don't even know, but they are actually fulfilling the needs that we need. So when we think of a food, we should not think of nutrients, we should eat the whole food. That should be the whole concept. Now, one of the biggest thing that I have heard from many times, and this is a common thing, is that, oh, if I'm plant-based, probably I'm not eating enough protein. But if you look at it, the amount of protein that the body needs will easily come from a whole food. So whether you're eating a legume or a whole grains or peanuts or tofu, you will get enough proteins from them. So there is no need of having an animal protein. Animal protein has multiple issues. One of the biggest issue is that it has fat in its layers. So even if it is skinned, thin, lean, it still has the fat. And then it slows down the metabolism. And then there are multiple studies which have revealed that the cholesterol goes up, the mortality goes up, the diseases, which includes everything, including heart disease and cancers, goes up. And so the approach that we will be discussing today about is something that we call a full plate approach. So 75% of the plate should be full of fiber, which includes both soluble fiber and insoluble fiber. So fruits, vegetables, whole grains, nuts, and seeds. And in the 25%, one can have the grain, the other stuff, which is the and anything you want to add. If you want to add a samosa, you want to add a jalebi, you can add into that part. So it will fulfill those requirements. So in moderation. So again, the idea is to not to restrict to what you like, but at the same time try to do it in a holistic way. That okay, I'm going to eat it in moderation, but after I have done the job, it's like okay, I've done my good work. Let me take this thing also. So the whole concept of full plate living is that you have to have a plate which is full of fiber, whole grains, legumes, and then add on something that you want. And you can basically flip your current food pattern to something that can be as similar to this as possible. So I will, after this, I will give basically how to do is more important. So the more important part will be done by Dr. Ritu. So the next few minutes from Dr. Ritu.
Thank you, everyone. I appreciate you guys giving me this opportunity to share what I learned in the last couple of years from, lifestyle medicine and the evidence-based nutrition and things which were imparted by my parents to be skilled in cooking and, of course, supportive husband and my love for food. So we'll see how we can put all these things together and make the food delicious at the same time healthy. So coming to the workshop, we'll discuss in some like basics of food cooking, where to do the groceries, and some healthy meals and snacks, and then some tips and tricks of cooking. So for grocery shopping, it is good to buy produce from a local farmer's market because the food which you get is fresh, seasonal, and does not travel that much. And I have yet to go to this Houston farmer's market, but I've heard lots of things about it. But the other places where you can get a local farmer's produce is Aldi, Trader Joe's, and Whole Foods. Especially the Aldi, the fruits mainly, you can get at a very reasonable price. And these are a lot of the produce they have is organic. So definitely the question, should we buy organic or not? So Environmental Working Group is a nonprofit organization, and it releases every year the list of produce which have a lot of pesticides, and these are called dirty dozens. So especially anything which is more like leafy green and does not have a peel, these are the produce which are highly susceptible to the pests, and so they use a lot of pesticides. So your strawberries, spinach, kale, mustard green, collard, your pear, peaches, apples, grapes, and also, vegetables, bell pepper, green beans, they come under this list. Now, what you can do is you can basically buy these products organic. Now, some of these vegetables are so easy to grow in your backyard. Spinach, kale, you can just grow in your backyard, and even the beans you can grow. And say suppose you buy these vegetables and you don't have, you didn't got the organic one. There are simple hacks to do it. You can actually use some vinegar into the water and soak your berries and grapes for 10-15 minutes. That also tend to reduce the content of the pesticide. But pesticides are known to be precancerous. They are known to be carcinogenic, and also they cause neurodegenerative disorders. Now, should you buy everything organic? Probably not. So this is another list of 15 foods, 15 vegetables and fruits which are low in pesticide content. And many of these, they have outer peel, which we can peel and consume. So now coming to some basics of, healthy kitchen. So I'll go with one by one. Definitely, Anil talked about whole grains and, not consuming the processed food. So substitute your white sugar, the refined sugar, to the natural sweeteners. So you can use, jaggery, you can use date sugar, you can use coconut sugar. I use agave syrup in my tea or coffee. You can use maple syrup. And for, say, oatmeal or anything, sweet you want to have, you can actually use some of these dry fruits and even banana to create your own, dessert or a healthy breakfast oatmeal. So then comes, yes, switch from your refined flour to the whole grain flour. So I know from Indian store we get, wheat flour, but you can actually buy the multigrain flour. So, and even if the wheat they use, say for some reason they don't have the whole wheat and they use some processing part, but really for the millets like the ragi, your sorghum, for chana dal, they can't over process it. So they have to mill it with their outer husk. Now change white rice to the brown rice. I know many people don't like the brown rice because it doesn't taste that great. But I'll tell you, what you can do is you can add some vegetable broth and put a little bit salt and cook it that way. It tastes amazing. And also you can make your own vegetable stock. Whatever vegetables you cut, keep collecting it in a small bag, put it on the stove with ample water, throw in some cloves, cinnamon and your tej patta, boil it, strain it, use that water for making your brown rice. It tastes amazing. Now, another important thing, which Anil didn't talk much about, the dairy, especially the milk. And, so it's known now that 90 to 95% of the Asian population is lactose intolerant. And if you count about the world population, 75% of the world population is lactose intolerant. So when you are lactose intolerant, you are really not digesting that milk well. And the casein in the milk is actually very inflammatory. So we have chronic inflammation. We're dealing with all these health issues because of the underlying chronic inflammation. So casein is inflammatory. Not only that, the cows, how they are bred, how they are fed, and they use a lot of hormones. All those come into the milk, which we consume. And then we start having this issue of gaining weight. And, even actually, I recently read that milk, dairy milk especially, has been connected with certain cancers like the prostate cancer. So what to do? Yes, switch to plant milk. You can buy the plant, the grocery from the stores. You can buy the milk, but really making a plant milk involves just 3 steps. Soak any of the plant, any of the nuts you want to make the plant milk. Just soak it and grind it, and then just strain it. That's all it takes. For especially almonds and all, the shelf life will be like around 3 days. So make sure you keep it in the fridge. And we switched, most of Indians people, they love their tea. Do try this homemade almond milk and try it in your coffee or tea. It tastes amazing. Actually, when we put like ginger and other cinnamon and everything in our chai and boil it, you actually start to taste all other ingredients, and the real taste of the tea comes. So I would say do try this. Another thing which we, being Indians, we love our oils and we love too much cooking. We overcook. So try to minimize oils. See, oils per se, they are refined. very few, unless you have a cold pressed, olive oil, yes, that is not that refined. But most of these, they undergo, a lot of processing using really harsh chemicals. So, I usually make like, serving of 4 or 5 people, like soup or any vegetable or any, lentil. I just put like half a tablespoon of oil. And you can do it. If you use a non-stick pan, you spread that small oil on the surface and saute your vegetables. You just have to be careful with the, temperature, but you can do it. So it's worth doing it because oils are inflammatory again. Don't do overcooking. Stir fry, don't like overcook because that also deprives it of its nutrients. Now, we talked about all these foods adding, but really the most important thing so that we can, do it successfully and we can sustain all that healthy lifestyle. Being so busy, we definitely need to do the meal prep. Now, meal prep really goes very handy, especially if you, pre-cut your vegetables and especially the salad, because salad is something which we, if we have to cook the meal and then go and cut the salad, peel carrot, peel your radish, or that takes a lot of time. And if we are thinking of doing it for, every meal, oh yeah, forget it with all other things which we are caught up with. So always pre-cut your salad, wash your fruits. So this I'm going to show you like the fridge I have in the lower portion. What this one has a lot of stuff which I use every day on an everyday basis. Like in the morning I make oatmeal, so all these nuts in these compartments, containers, very easy. You just pick up and add to your oatmeal. So, planning and strategically doing things becomes really important when you are on this journey of healthy eating. So now we'll come to some ideas. Oats is a very good option for breakfast. I know many people, they have to, get used to the taste. But for that reason, you try any of these new foods, your taste buds, they start to adapt. Give it a time, like 4 to 6 weeks, and your taste buds, they start to adapt that change. So it is one of the healthy breakfasts. You can also replace this oats with our barley or jawar, sorghum or cracked wheat, and even millets. Now, how you make the morning breakfast is you take any of these grains, which are pressure cooked, and then you add fruits, especially berries. Berries are low glycemic index food and they are very rich in phytonutrients. So use different type of berries. You can actually also use dry berries. So I found from the Indian store mulberries. You can experiment, you use some, raisins and even goji berries. We had that this morning in the breakfast. Now, cut some nuts, soak some nuts, or you can saute some nuts, add that to the, your oatmeal. And for, again, to try avoiding using the, your animal, your cow milk, use the plant milk option. You can use, when you use so much of, fruits, banana and everything, you really don't need a sweetener, but then choose natural sweeteners if you do want to. And you can play with it. Like you can make so many different ways. The oats, this morning we had masala oats also. And same thing. So not just don't limit yourself with the oats. You can play with any grain. Now this one, on the right side, I made actually with the rye kernels. And it tasted amazing. Well, I'm not asking you to just eat oats. We can eat our regular breakfast too. Just replace, if you're using the white, refined rice poha, you can try some brown rice poha too. But again, once a while, if you're eating white rice, that's not a problem. That's absolutely not a problem. But don't, try experimenting with different things. You can make poha with millets. You can make millet upma also. So be innovative and try this out. Ultimately, what we are trying to do is eating whole grains and putting as many as vegetables, healthy stuff in our diet. Well, this I made, chila with lots of, vegetables. And so any fermented batter, if you have, or even if you don't have, soak your lentils, any lentil, grind it, make a paste, throw in as many as vegetables as you want, use a non-stick pan with minimal oil, and ready to go for a good breakfast. Now we are eating these vegetables and, with grains, but still for the breakfast, don't forget about your bowl of fruits or a smoothie. You can, consume one chila, but add other things so that it is more healthy. And why not to enjoy paratha? We all love paratha and we should be eating it. The only thing is, as he said, combine things together. So I'm eating a paratha. This one I made actually homemade kimchi. The kimchi we get from the stores, they have that fish sauce, and we don't like, I personally don't like all that. But I found a recipe on YouTube and made a kimchi, very simple and but very delicious. I often add some sprouts and eat that. It's a very good way of adding some nutrients there. And, a good replacement for your egg bhurji, a tofu scramble. And, we are Indian and we like our spices. Try just the same way. Just throw in turmeric, throw in all these wonderful spices which we have and make it. I don't know if I have been now started eating all these that I started, enjoying it. And I don't even feel that much difference anymore. But again, give some 4 to 6 weeks time and the taste buds, they change. Really start to enjoy all these foods. Sprouts is another thing which we should, start incorporating in our food, and very easy. I actually saw a video on YouTube. They just took our own old dabba and drilled some holes, put any of your seeds and they'll sprout. Because with the sprouts, you have to strain the, you have to change the water every 12 hours. Otherwise, they can go bad. And you can eat these sprouts, just take a handful of sprouts, put some raisins and just eat it. It tastes good. Or you can make it as a salad or, Now, another thing which is a great way to consume, all these nutrients in a one meal thing is make a green smoothie. And, kale, beet greens, they have, these are actually, nutrient. They are not calorie dense, but they're nutrient dense foods. So make your smoothie green, like use greens in your smoothie. So I have kale growing in my backyard, and very simple, very easy to grow. You can just grow kale in a pot and it doesn't require full sun. So even if you have a patio with shade, it will grow wonderfully. And we saw that this was one of the, vegetable which was listed high in pesticide. So fill your half of your, mixer jar with greens, add again fruits of your choice, but still prefer berries. And with berries, because we saw that a lot of these have pesticide, using a frozen berry is a very good option. And actually, we always think like, oh, frozen food, it's not fresh food, and we limit ourselves. But really, in studies, it has been seen that frozen food is equally nutrient, except for that it loses some of the vitamin C. But because why? When they freeze the food, they actually to the fruit maturity. They they let the fruit or thing mature to its ripe state, and then flash freeze it. So all these nutrients are there. So don't be afraid of using the frozen stuff. It is economical, and you can buy a lot of organic stuff, especially for berries and, stuff like that. Now, another thing which you should, really add to your smoothie is flaxseed. Flaxseed is called alsi. We have used traditionally in ancient in India always. So alsi is very rich in fiber, and it has omega-3 heart healthy fats. So just saute some alsi seeds, the flaxseed, make a powder, and in your smoothie at least put one boiled peanuts, quinoa, everything. Now, I actually like these edamame, shelled edamame, which is soya. So soya is good. Soya is, is a complete protein. So being vegetarian, we are worried about this protein stuff. So eat soya, and this fresh, soya, which is called edamame shells. You can get it at Aldi or Kroger, and use that in your salad. And you can choose any kind of dressing if you want it more flavorful. Now, next thing is fermented food. It's a very good source of probiotic, and most of these fermented foods are also very flavorful. And a lot of these we already know. Your khaman dhokla, idli, sambar. Who would not like these to eat? So even when we are going out, we can enjoy more of these food, especially the kanji, which we used to have when we were young. My mother used to make, very simple to make. Just cut some carrots or beets, put some water, put kala namak, and just leave it for 3 days. That's done. A good fermented drink. A word about millet. Millet is another thing which we can experiment with, very versatile. I generally, when I soak, a big amount of it, and then grind some, make a pressure cook some to go for my oats and grind some to make either to make some pancake batter or even like a dosa. Okay. And then hydrate well. You can just use any of, you can cut slices of lemon or any fruit. So if, to increase your water intake. Desserts, go for healthy options. Again, your options are, fruits, whole grains. You can enjoy these desserts as long as you are in moderation. Quick snack. Just cut a date, fill it with some peanut butter, put some dark chocolate, 1 minute dessert, which you can do, enjoy. And I often take a small piece of dark chocolate, smash a prune, and enjoy that. This is another, quick option. Just simple ingredients combined, and you can enjoy a healthy snack. What other options for healthy snack? Your fruit chart, vegetable chart. Eat momos, sweet dumplings, vegetable cutlets made with lentils, tofu, quinoa. And don't forget this puffed corn or even makhanas. Now, last slide. So helpful tips. When many people, when they eat beans, they feel very gassy. So soak your beans, discard that water. And when you boil these beans, remove the scum, that white thing out of it. You'll be easily able to digest those beans. Now, a word about air fryer, make your whole process convenient. So when using the air fryer, keep the settings at a lower 300 to 350 degree Fahrenheit. This way you can actually avoid, losing a lot of nutrients. And make use of Instapot, especially the delay setting option. You can put everything at night, put a delay setting option, and your cooked grain or every quinoa or everything is ready to be used. And use oil sprays. When you add all this fiber food, make sure you add it gradually and drink plenty of water. And stick to the full plate concept. And when you travel, carry your healthy snacks, fruits, and cut vegetables. And make whole this experience as a family fun activity. I want to just, because one of my, these are the resources which we got, learned from all this. And can you play that small video? There is 1 minute video because one of the participant, it's the reason I'm saying one of the school kid over here, she actually, created that video. I really wanted to, as a token of thanks to her. So this is our Kanak, that all kid.
Oh,
Ferment, take food, and very. Great. So you're putting some cabbage in the jar and putting some salt. That's it. Oh, wonderful. आप क्या कर रहे हो? क्या और इडली overnight Friday
We'll skip the discussion, but we'll keep the discussion in the end. It's not yours. It might be.
I just gave him speech. Yeah, it was on.
The USB drive, this one,
No, no,
this,
no.
oh. Okay. Okay.
So
yeah,
this
that-
is.
No, this is mental wellness. Oh, no, hard drive.
She took her. So where's your? Okay. They plug it in. Plug it in. Oh wait, but where's? Oh wait,
Not one of these two. Drive. What's this?
no. I think.
Right.
Here's-
This
Uh,
one.
Okay, so let me just go to Zoom. Okay. All right, namaste and good morning. Who's not hungry now after listening to this? Yeah, my name is Manish Wani. I'm by trade an otolaryngologist, ENT specialist out at the west part of Houston. And so my forte is really things like chronic sinusitis, sleep apnea, head and neck cancer. But what we found over the years is that all these diseases are one of the real diagnostic or contributing factors to this are allergies. And so I was asked to give a talk about allergies. And so what is an allergy? It's one of the most common chronic conditions in the world. And it's where a body's immune system makes an otherwise harmless substance as an invader. And the immune system overreacts to the allergens, and it produces all these what's called IgE antibodies. And the IgE antibodies then travel to cells that release different other types of cells like histamines and whatnot to create reactions like rashes, runny nose, sneezing, and even worse things like anaphylaxis. And allergy exposure can occur through a lot of different ways. One is just touching or contact with the allergens, for example, the pollen or things in that sense. And then also from breathing in, and then ingestion, which is food. So we're going to talk a little bit about the food allergies. Now, the allergy cascade, it's a very complicated cascade. And when the allergen comes into the body, it initiates these reactions. There's an early phase reaction, there's a late phase reaction, and there's a lot of mediators that affect and cause the subsequent problems or reactions. Now, we have a number of different allergens that are responsible for these allergic reactions. And some of the most common ones include things like pollen, dust. Food is one of the most common ones, insects, animal danders, mold. There's medication and drugs, and of course, latex as well. Now, again, like I said, it's a very common condition, and allergic diseases affect 40 to 50 million Americans. And so that's almost 1 out of every 4 people have issues with things like asthma, allergic rhinitis, and these can lead to things like sinus infections, eye infections or allergies, skin allergies, food allergies, insect allergies, and then, of course, anaphylaxis. Now, the food allergy has actually become quite a bit of an epidemic in the United States. In fact, they say that about 32 million people have food allergies. This is about 1 in every 10 adults and 1 in every 13 children. And again, the reactions can range from some mild reactions to severe life-threatening reactions. In 48% of adults who have food allergies, actually this occurs in adult onset. In other words, they were tolerating it as kids, but as adults, they developed these food allergies. And that has been very perplexing to doctors as to how do you get these allergies as an adult. And these are the 8 most common foods that can cause a food allergy. And that includes eggs, peanuts, fruit, fish, tree nuts, soy, dairy, and wheat or gluten. Now, but any food can cause an allergy, even fruits, seeds, corn, meat, gelatin. Now, when an allergy or an allergic reaction happens, it is a multi-organ manifestation. It can involve the lungs, the nose, the throat, sinuses, stomach, and skin. It can provoke asthma by causing inflammation in the lung. And then, of course, it can be a life-threatening reaction where anaphylaxis is involved. So just a little bit about anaphylaxis. It is a severe life-threatening reaction, and it affects the entire body. And the symptoms can begin within minutes to several hours after exposure. And in fact, every 3 minutes, a food allergy reaction sends somebody to the emergency room because of anaphylaxis. So what happens during anaphylaxis is that there's just an overload. The allergens cause an overload of antibodies being produced, and it affects the entire body. You get a sense of this impending doom, acute onset of just feeling unwell, and then your skin can start becoming red. There's flushing, urticaria, angioedema. And then it can also manifest in the nose with nasal congestion, runny nose, sneezing. And then the lungs, it can start causing a cough, wheezing, chest tightness. It can cause nausea, vomiting, cramping, diarrhea. And then it can affect the heart too by causing low blood pressure, tachycardia, and then a lot of people will faint with this. So just to keep in mind, in the anaphylaxis management, time is of the essence because if you don't manage it in time, the patient can perish. And so most people that have a known allergy, they'll carry their own EpiPen or epinephrine. Because that is the management for this, the first-line treatment. And in adults, it's 0.5 milligram. In kids, it's actually 0.01 milligram per kilogram, up to 0.5 milligram of the epinephrine. And it's an auto-injector, and you have to just push it into the anterolateral part of the thigh to deliver this epinephrine. It's also called adrenaline. Symptoms will typically subside right away, but you can re-administer it after 20 minutes. But all these patients, if this happens, you have to call 911. They should go to the emergency room and then be managed because it can, again, cause low blood pressure. So you may need to give them IV epinephrine or vasopressin. So these are just the different types of auto-injectors that they have. And again, like I said, in our practice, we have a pretty robust patient population that have allergies, environmental and food allergies. And for us to treat them, they are all required to carry one of these auto injectors. Now, just something on the horizon. It hasn't been FDA approved yet that I know of, but there are, these auto injectors can be somewhat burdensome to use. They're coming out with this epinephrine nasal spray. And then there's also epinephrine that's coming out where you can put it under the tongue. And hopefully in the next 6 to 12 months, these will be available. The other treatment for anaphylaxis or for any allergies include things like corticosteroids, like prednisone or methylprednisolone, antihistamines like H1 blockers like Benadryl, H2 blockers like Pepcid or Zantac, and then bronchodilators to help with the wheezing. So how do you know if you have allergies? And this is, again, one of the things that we do in our office, but there's different ways of treating or testing for allergies. The first is what's called a skin prick test. Now, this is more used for environmental allergies, but you can also isolate the proteins from a food and inject it under the skin and see if there's a reaction. It takes about 10 or 15 minutes. It's not very specific for food allergies, but for environmental allergies, it's very specific. The most common way to test for food allergies is there's a blood test. It's called a RAST, radio absorbent serum test, and there's a whole panel that Quest Diagnostics, any of the big lab groups have, and they'll check for the top 8 as well as the other types of food allergies. And what they're testing for is to see what your antibody level is on certain foods. And if it's truly very high, that's where they tell you that you are allergic to these food allergies. The most specific way to test for food allergies is something called an oral food challenge test. And they do this a lot in pediatrics. Now, we don't do this in our office, but a lot of the allergist immunologists will do that. And essentially what they're doing is giving you small doses of something that they think you may be, or that you think you may be allergic to see if you'll develop a reaction. Now, this has to be done in a very controlled setting because oftentimes this can cause an anaphylaxis reaction while you're testing. And then lastly, at home, you could do something called a food elimination diet. And that's where you you start with the basics of food and see how you feel on that. And then you start adding different things to see if what could be causing some of the symptoms that you have. Now, the question is there a cure for food allergies? And there really is no cure. Now, there's tons of papers and research that's been done, but currently the only way to avoid a reaction is to know what you're allergic to and then avoid ingesting it. Now, there is something called oral immunotherapy that may be able to help. And that's where you try to desensitize yourself by taking small increments of whatever you're allergic to. And you do this over a period of time, and it can take up to 2 years to desensitize yourself to this. But you take small amounts and then you slowly increment how much you take to get your body to develop a resistance to the food. Now, there is a difference between food allergies and food intolerance. Now, food intolerance is a term where patients can get, or people can get reactions to food, but it's not necessarily an immune reaction. And the complaints are variable. They include fatigue, brain fog, GI complaints, and it can, the symptoms can occur within hours, but sometimes it can take up to days. And one example of this is like lactose intolerance. It's not an allergy, but it's just it's due to the inability of the body to break down the lactose. And so that's something that is good to decipher whether you have a true allergy or if it's a food intolerance. Now, the other part of this is just allergic rhinitis, and this is more about environmental allergies. And so we're talking about things like pollen and dust mites, ragweed, things like that. These are much better tested in terms of we can isolate exactly what people are allergic to in terms of environmental allergies. And again, treatment for this, a lot of this is over the counter now. Nasal steroids like Flonase, Rhinocort, Nasonex. These are nasal steroids that help decrease the inflammation in the nose. Even though they're steroids, they're very safe to take. In fact, we have patients that take them on a daily basis to cut down on their symptoms. It doesn't get into the body as it's just a topical spray. Antihistamines are also very benign, things like Claritin, Zyrtec, and Allegra. We recommend saline irrigations, the Neti Pot or Neilmed or Navages, just to clear out the allergens from the nose. And then, of course, you know, especially for environmental allergies, there may be some underlying structural deformities, and that's where, as a ENT doctor, we can help in terms of if you have a deviated nasal septum, if you have nasal polyps, chronic sinusitis, allergic fungal sinusitis. These are things that really medications or immunotherapy aren't going to help, and we can fix that structural abnormality. And then finally, immunotherapy. Again, this is not for food allergies. This is more for environmental allergies. And again, we do the testing. We test for about 38 different environmental allergens that are in the Houston area. It's on the arm to see what you react to. And then we could do what's called SCIT, which is subcutaneous immunotherapy, or SLIT, which is sublingual immunotherapy. But this is, again, where we're giving the patient small doses of what they're allergic to in an incremental fashion. And it typically takes about 3 to 5 years to develop a desensitization to these allergens. And that's all I have. Thank you.
Good morning. If anyone here has signed up for EKG and has not yet gotten it done, please proceed to get it done, because they will be leaving very shortly. So if you have signed up for EKG and have not yet gotten it done, now's your chance. And the next speaker is Dr. Renu Thomas. Yeah, please welcome.
Namaste. My name is Alpa Shah, and I'm the president of newly formed Reach Mental Wellness Organization. Group of us formed Reach Mental Wellness Organization in order to identifying the dialogue that has to be opened within the Indo-American community about mental health issues. At the national level, recognizing and treating mental health issues has made a progress, but a gap exists in the Indo-American community for addressing these issues. The mission of REACH is to educate and create support for mental health wellness in the Indo-American community by forming a network of resources. Through several initiatives, REACH aims to destigmatize mental health issues in the community by providing information and treatment and a diagnosis treatment for mental health wellness in the community. By addressing these issues as a group, as a community, we can support our loved ones, our neighbors, our family who are suffering from mental health issues. On behalf of Reach Mental Wellness, I would like to extend my deepest gratitude to Arya Samaj for giving us the opportunity to address mental health wellness. I would also like this time to address and organize and introduce my board of directors, Ms. Ranjana Wadhwa Bedi, the secretary, Ms. Viba Agrawal, treasurer, and our director of communication, Rajan Radhakrishnan. Please go to our website, reachmentalwellness.org, and know more about Reach Mental Wellness and get involved in this organization. There is a saying that you are as healthy as your mind is, which reflects the true importance of mental wellness. In this journey of life, we all go through ups and downs. what is important is how we react and how often we remind ourselves that these hard times are just temporary, because we all are capable of attaining happiness and fulfillment in our lives. Today, we are honored to have Dr. Renu Thomas as our speaker. Dr. Thomas is a licensed psychologist. Her specialty is treating patients afflicted by a variety of mental health conditions such as trauma, anxiety, depression, addiction, and eating disorders, to name just a few. Previously, she was a postdoctoral fellow at the Baylor College of Medicine and the Menninger Clinic before becoming a staff psychologist at the Houston Methodist Behavioral Health, where she worked in the outpatient program doing psychological assessments and also counseling for individuals. Her talk is titled, Is Mental Health Stigmatized, Recognize, and Recover? Before I invite our speaker, I would like to also say that Dr. Thomas and Ms. Bhavna Luthra has agreed for 10 minutes free consultation if you need to today. Without any further delay, please welcome Dr. Thomas to the podium.
Thank you, Alpa. Thank you everyone for being here. I was a little concerned when they said go for EKG. I was like, you all are going to take that and get out of here because it's mental health talk that's coming up. But I'm glad everybody stayed, hoping that you all, I also wanted you guys to have your EKG done. But I really want to thank everyone for being here, honestly. It is a big privilege to use my voice and my experience to start a conversation, an open and honest conversation about mental health. Why mental health and why talk about it, especially after these delicious conversations about food. And even though the allergies kind of dampened it a little bit, but why talk about mental health and why with our community? Very few studies have been done with South Asian Americans. So the data that we have is limited. But even within that data, it suggests that a high number of people experience anxiety disorders, mood disorders like major depression or bipolar in our community. So this is not a Western issue. This is within our community. In fact, a World Health Organization, I didn't even put my slide up, did I? How do I get to the slides? Sorry. So why mental health, right? There's a study by World Health Organization that says 1 in every 5 Indians need mental health help. That is many of us in here, right? And if not all of us, to some extent, and I'll get to that in a little bit. So despite this alarming rates, and there's also studies that say greater rates of people who are thinking about suicide. So especially in our younger generation, adolescents and young adults, there's actually a high rate of suicidality that's being found again in this study. And you can imagine how much those numbers have gone up since COVID. No studies are there to kind of prove that, but we know that there's an alarming rise in mental health crisis globally. And so despite this alarming rates of mental illness and mental health problems, South Asian Americans are the least likely to seek out help compared to all the other racial minorities in America. Why? Because mental health and mental illness is one of the most misunderstood and stigmatized conditions that exist. Let's explore this a little bit. Stigma. What is stigma? Stigma is our negative opinions and attitudes that we have about mental illness, the topic of mental illness, and also towards people with mental illness. And that shapes how we feel about them, how we think about them, and how we act towards them, including the way we talk about them in public. So this is what stigma is. And mental illness, unlike physical illness or an allergy where you can see a rash, you cannot quite see that. And therefore, if I cannot see something, it must be not real. So that is a stigma towards mental illness, that this is not a legit sickness. This just in that person's head. And we sometimes say, oh, it's all in your head, like there's nothing in your head, right? And thanks to media that sensationalize a lot of these stories, how is media portraying people with mental illness? They're dangerous, they're unpredictable, they're unreliable, they sit and drool. There's just a lot of negative characterizations of people with mental illness, which if someone is going through a distress, that is going to be shaming, like that's shameful to them, that's embarrassing to them to open up. And in our community, there is stigma even about talking about anything negative. So I cannot talk about it with my family because why would I burden them? I cannot definitely talk to someone outside of the family because that would be shaming my family. And I don't trust people outside of my family and they will not understand me. So there's an overall stigma that people with mental illness carry, and also the public carry about people with mental illness. The next pointer up there is the model minority stereotype. What is that? Some of you may have heard of that. All that means is there's an assumption that because we are, either our parents or we are immigrants from Asia, and we came here and we are all accomplished, we are successful, we have no problems adjusting to the American culture, therefore we shall have no problems. Somebody else could have a problem, but I am not the one having a problem. And I have to pretend like there's no emotions, I should be okay, I am functioning fine, I'm married to a good standing person, and I hold a good job. Everything is wonderful about my life. And that is the model minority. Asians are the model minority community in America. And what happens with that, any deviation from that model minority stereotype is judged very harshly by our community. If I am to lose my job today, my families will be on the phone asking, hey, what's happening? This is not okay, right? Maintaining the family's reputation is even more important. If I am to go out and talk to a therapist about my marital struggles, then that would be putting my husband down, putting my family down, shaming them, again, mistrust in seeking help. But maintaining a positive image in the community, in our social standing, is much more important to us than having a meaningful life, having a joyful life. Another point I want to talk about as a social factor is any topic that is remotely distressing. We all like to talk about good things, wellness, yoga, feel good, eat good. But the moment we start talking about, I'm feeling blah, and I don't know why, any talk about vulnerability is not accepted in our homes, even. And I'm not making a generalized statement, but it's true in many of the Indian homes where we don't talk about taboo topics. And what are some of the taboo topics? Money. We don't talk about handling money, handling stressors, marital struggles. We don't talk about domestic violence. We don't talk about mental illness. We don't talk about what is it like to move to a new country and the struggles behind that and how you navigated that. So how you adjusted to the new culture. We don't talk about anything that is remotely vulnerable. So a way to understand mental health is to see it on a continuum. Okay, what is mental health? Mental health is your physical, aside from the physical part of things, you do not have health without mental health. So mental health involves that part of your brain, and I would say your gut too, that helps you in acting, feeling, and thinking in a positive way. So that part of you that helps you to handle stressors, cope with stressors, relate to people, make meaningful connections, and cope with life. That is your mental health. To see it on a continuum is a very helpful way to think about it and understand. On one end is the healthy baseline, where we mostly find ourselves. We are going about our day. We make decent decisions. We are happy for much of the time. We manage our stressors okay. We cope with it. We sleep okay. We eat okay, right? That is the healthy side of things. Now, we are human beings. We have stressors. We are going to be impacted by them. The impact of the stress could be something as minor as I'm losing sleep over having to give a presentation. Or it could be something long lasting, which is that I am so scared to face life that I'm not gonna get out of my house. I isolate myself. Or it could be severe that all I'm thinking about is how to end my life. Or I am drinking excessively to the point that I'm passing out every night. I'm not engaging with my family. So those would be an extreme distress, whereas we are all susceptible to stress and minor distresses. So when you look at this continuum, depending on where you are in a day, you can notice that mental health for me changes depending on the day. Today, my anxiety is a little high because I have to do this presentation. Yesterday, if you caught me, it was even higher because I'm preparing for it, right? But tomorrow, in an hour, my anxiety is going to drop. So I'm going to come back to my baseline. So that is mild. And where you stand on that continuum determines what kind of approach you need to take to intervene. So if you have a mild to moderate issue of mental health, or distress, I should say, then the interventions would look much different than if you are having a severe, persistent mental illness like bipolar disorder or schizophrenia or major depression. That may need multiple approaches, that may need a longer term of support and recovery time. This also should give us hope that our mental health can vary depending on our circumstances, okay? You may be susceptible to stress in this moment, but you can, using some coping skills, return to baseline. So what causes mental illness? Quick run through of this biopsychosocial model. Dr. Anil and others too talked about holistic, right? A holistic understanding of mental illness. It's not an unreal illness. The biological impact would be your genetic makeup, okay? You may have a family history of mental illness that was never talked about or intervened, but that makes you susceptible to having mental health problems. Your brain chemistry, the dopamine levels, the serotonin, the neurochemicals that Dr. Anil talked about in your gut, the levels of those can vary in a human being, and that can determine whether you are more likely, not that you will get it, but that you are more likely to experience extreme distress, okay? Psychological components, on the other hand, would look more like, how do you think about the world? How do you think about yourself? When you look in the mirror, do you like what you see? What are your coping skills? Are you someone who tried to simply avoid dealing with issues, either by drinking or just not dealing with it? Or are you someone who has some healthy coping, like exercising, yoga, meditation, seeking support? Do you have good coping skills? Do you have good emotion regulation? What that means simply is that we all have a capacity to regulate, to manage our moods. And so some of us are sensitive, more sensitive than others. and that makes us a little bit more susceptible to responding to stressors in a negative way. Social components, social causes of mental illness would look a lot like, how does this person view their social support? So do we have a community like this, to support us, to make space to talk about a taboo topic? Do we have family conflicts? Is this person having marital troubles? Is this person having conflicts with their children? And so I know some of you are in the parents' generation, and I would guess that there ought to be some conflicts when you immigrated from India to here, and how those cultural values that we grew up with are different from our kids' generation and their value system. And how do we reconcile that, right? So where is your acculturation? All that means is how well adjusted you are to your current culture. That can impact the susceptibility to stress. Of course, the stressful life events that happen can impact that. So all in combination can make someone more susceptible. So an example would be someone with, let's say, someone who had severe allergies, right? And have been a sickly child. I'm just using the examples that you just heard. Sickly child in and out of ERs, chronically sick. That's the biological makeup, right, of that person, because it's a chronic medical condition. Let's say that person has a poor coping mechanism. They're fed up of how they look at themselves, and they feel they're very sickly. They've been very protected by their parents growing up because the child gets sick all the time. So I want to protect. Let's say this person has never found a connection with a social group. No friends, isolated, keeps quiet to themselves. That would be the social. A person like that may be more susceptible on that continuum scale that I showed you to be closer to the orange-red slide, because they are more susceptible to stress and have problems with how they think or feel or act. That made sense. Than someone who did not have those medical conditions or has support. And also has an internal sense of safety. So how do I know? How do I know that I am at a point where I need to seek help? We know ourselves to the most part, and the goal is to ask yourself, is this my baseline? When I say normal, I don't like that word, but what I mean by that is your baseline functioning. If you are getting decent sleep and all of a sudden you can't seem to get rest, you cannot, you're waking up groggy, you used to eat okay, but your appetite is not okay anymore. Or you used to occasionally drink, but now you're drinking excessively. Baseline, you probably worries about your spouse, your kids, your health, but now that worry you cannot get out of. You cannot stop the worry. So the key words here to know whether a behavior is becoming excessive or is pointing in the direction, taking you from that green, which is the baseline functioning, to a mental health problem, is to ask those questions. Is it frequent? Is it happening often enough? Is it something that's intrusive? I can't control it. Is it lasting long, for a long period of time? Is it causing me distress? Or distress to people, with some mental illness, there is no insight. The person may not recognize that this is going on, especially if you are having problems with alcohol use. You may think that I got this. Especially, men tend to, in our culture, kind of tend to think that I got it under control, but their spouse probably would know, hey, you are hitting me after you're drinking, or you are shutting down, you're throwing tantrums, and this is not you. This is not the one I married. So your loved one would be the first to notice those changes. So is this causing distress to you or your loved one? And the last question is to ask, is this getting in the way of my life in any way? My marriage, my role as a parent with my children? Is this affecting outside of my family life? So with work, Am I not showing up to work? Am I having terrible panic attacks before I have to do presentations? Then the normal anxiety I would experience right now would be in a level where I need intervention if I cannot do presentations as a psychologist. You see what I'm saying? So even I am susceptible to those distress. And so to understand those last pointers about each of those behaviors and how deviated you are from your baseline would help you to know that you need intervention. Oftentimes the challenge is, okay, I have some issue, but I don't know what to do with it. I don't know where to start, right? So again, going with a more holistic approach, we know that there could be some medications that could adjust your neurochemistry. So oftentimes, especially for South Asian Americans, this is a trend that I see at work too. They show up with a lot more physical symptoms, like aches and pains, stomach pains, headaches, migraines, body aches that are not truly justified by a medical cause. So they may have some medical condition, but it is not to the point where their experience is. So a lot of somatic symptoms show up more than internal, like thoughts, for example. So for them, they may go to an internist and, but with a psychiatrist too is someone who would administer the specific medications to readjust your neurochemicals. That's one way of treatment, one modality, right? I want to highlight the psychological treatment because there's a lot of taboo about what talk therapy would be like. And I'm a psychologist who does that, right? Who does the talk therapy and what that is. So what is talk therapy? It is more about retraining your brain to think differently, to think in a more meaningful way, to manage your emotions. How do you regulate your emotions when you get angry, for example? How do you manage it without resorting to alcohol or other drugs, right? And so retraining your thoughts, your feelings, and helping you to make meaningful behavioral changes. That's what the role of a therapist would be like. And it's much longer. It's not a quick acting. It takes the effort of the patient and the therapist. Finally, social changes. We heard a lot this morning about wellness changes that you could do and how that impacts your brain. There was a graph that you put, Dr. Reynolds, that directly goes to the brain. And so it affects the way you think. So making changes to your lifestyle, but also being more connected to your community. You don't have to be an extrovert, but having some meaningful interactions. Making changes to your social circle. That is an intervention that could be used as well. So finally, the point I want you guys to remember of all of this is that hope and recovery are possible, especially with early detection, early recognition. And mental illness is such that it doesn't discriminate. You can be educated, you can be wealthy, you can be in good standing in the community, you have the best social support, you have the best childhood, you still can have mental health problems because there is no health without mental health. Okay? So if you know someone who is going through mental health problems, what can you do? You're doing one of the starting things, which is educate yourself, right? Like here, make space, allow yourself to sit through something that may be a taboo still in your mind. I had someone tell me this morning out here that I don't have any problems, but you can talk about it. It's a good topic to talk about, right? But I would say I have problems. It depends on the day, what my stressors would look like. So we are not rocks. We are not plastic. We are human beings with thoughts and feelings, and we definitely have to deal with the world on a day-to-day basis, whether it be at home or be at work, right? So educating yourself to warm up to the idea of what is mental health? How can I prevent it from going from the green to the orange? And some of that is within your control, some of that is not in your control, which is where the impact of biology, your genetic makeup and everything comes in. So if you know someone who is going through some distress, kindly make yourself to be a safe space that for that person without judgment, with so much compassion, just listening in, you know? It could be something like someone having just a marital trouble. It could be something about, hey, my child is about to marry someone from a different culture, and I don't know how to deal with that. It could be something as, you know, I don't know why I'm having this, but I'm constantly worried about, I don't want to die, but I'm worried about dying, either death of my family members or I'm dying because my health is failing, even though I pass my physical, you know? So it could be any of that, but instead of judging them, oh, it's just in your head, just get out of it, just snap out of it. Instead of saying that, kind of like, tell me more, you know, how can I help you? Kind of being that safe space. Now, if you, on the other hand, has a mental problem, you find yourself going through a life stressor. We have so many life stressors we never talk about. I mean, as an Indian, I know nobody prepared me for marriage. Nobody prepared me for pregnancy. Nobody prepared me for losses, you know, pregnancy loss. Nobody prepared me for dealing with relocating to a new country, what that is, you know, none of that. And we, again, going back to, you know, making space for that person to open up and have a trustful space. If you are going through that distress, know that you are not alone. This is not just because something is wrong with you. It is just a human nature, human tendency that we could all be under some duress. And also know that safe space exists. You know, if you can't find it at home, it'll be in the therapy clinic, you know? And seeking help is not a weak, it's not because you're weak. It is a sign that you are, it is one of the most courageous things you can do is to seek help. And what can we do as a community? Of course, have platforms like this, right? How often do I get invited to talk about mental health? Not that often, right? But we all want to hear about diabetes management and cardiovascular thing. Not that those are not important, but health includes both physical and mental health, right? So challenging some of the stigmas, the stereotypes, even I have stereotypes about mental illness, you know, that I have to keep it in check when I see my patients, right? Supporting programs like REACH, wonderful organization. I mean, it's amazing how I truly by chance, I found them, they found me. And supporting causes, you know, supporting organizations that advocate for education, prevention, awareness, treatment, support those causes like REACH and so many other organizations all across US, which I'm so thrilled about that it's upcoming. You know, it is in response to tragic instances of losing lives, but it is high time that we talk about this. We cannot pretend that we are not struggling. Okay. And so with that, I leave here. If you have any questions, please do ask. And I would love to hear from at least some of you after this. Thank you.
Dr. Thomas. Wonderful talk, Dr. Thomas. Thank you so much. REACH organization will definitely have people reach. So the next will be question and answer session. So I'll invite all the speakers and the panelists, Dr. Mupidi, Dr. Rahul Prakash, Dr. Nitin Mahajan, everybody in the crowd. Please do come. Yes, Dr. Muralidharan, please.
Namaste. My name is Bhushan Verma. I enjoyed all the talks. Thank you very much for to all the presenters. I just have one question. When our esteemed nutritionist talked about the milk, I think 90%, if I may not be wrong, over here, people are grown up drinking milk. So, and I think usually we have had a pretty healthy life. I would say changing it at this point, is that the right thing to do? Or do you think there's anything wrong in continuing with the milk drinking as we've had always?
So, see the milk what we used to have before. The milk which we used to have before and the milk which we have now has changed. You know, it used to be one cow which used to be milked and it used to be pure. Over here, you know, they have milk from different cows. They make it as dry powder. They add things. And the way these cows, you know, are bred, fed, it's really inhumane. And they are, you know, for often these cows, they have mastitis, like inflammation, and they are given antibiotics. And the same antibiotics go in our system and messes up with the whole gut bacteria, which we talked about. So now, unless and until we eliminate that, we won't know. Yes, we can say we are healthy, but you know, we do have issues. Now, when we talk about health, sometimes we also feel like, okay, I'm okay, this is my health, but maybe we can do better. So in that regards, I feel if your goal is to really have energy, you know, then trying this is not a bad thing.
Thank you. A follow-up, is organic milk any better than the regular one?
Well, it could be because, you know, they say they are, you know, pasture raised, you know, fed properly, less exposed to these growth hormones. So, yes.
Excuse me, on a similar line, if you make a yogurt out of that milk, does it have a similar effect or it get converted into having more probiotics and is better for our health?
Yes. So when the milk, you know, it gets converted into the yogurt thing, it gets fermented. And these lactose bacilli, they break down that lactose, that, you know, protein. And what I've, you know, have read is it's the casein in the milk, which is, you know, causing more of an issue. So I guess, yes, if we buy an organic milk and make a yogurt out of it, that will be a better choice to have.
Sorry, I had a quick question. Just to follow up on the milk, and then I'll ask my question. What about raw milk? So we consume raw milk, which is from a single cow. I agree with you on the hormones. Raw milk is available in Houston, and it's bioavailable for vegetarians. So just a thought.
Yeah, so all those things which I talked about, they were, you know, how these cows are bred and how these. Now, the other thing with the animal, with the cow milk is, see, if we are, there is a question about like, you know, what kind of oils, fats we should use. When we talk about these chronic inflammatory conditions, cardiac disorders, so the chronic inflammation and cardiac disorder are also go up when we increase the saturated fat in our diet. So, you know, if you are not taking saturated fat from any other sources, then probably it is okay to have little milk, you know, not like, you know, how we used to consume. You know, a child who is growing, oh, milk is good for bones, milk is this, milk is that. But when we come and put anything in our mouth, we also have to think, really, this is what we need to, you know, is this the only thing which is giving us, or it is also causing some harm? So I guess
Okay.
that's it.
No, I'll just confess one thing. I'm a low carber. We eat low carb in our house. I had a question for the doc, for Anil ji. One of the things I notice is, see, I was a diabetic, A1C of 8 or something. Today I'm 4.9. And it is all by eliminating grains. So the problem with grains in my mind, and I can see it with my CGM or anything else, is I'm talking about grains only. I agree with you on refined grains or unrefined grains, sorghum, anything. Your glucose goes up immediately. So what is the approach in a pure plant-based diet to handle that? How do you handle diabetes patients where if you continue to have grains, you convert it into glucose, your sugar goes up? Isn't that a risk with having carbohydrates? That was my question. Like grains.
So that's a very, very, very valid and very good question. First of all, congratulations. A lot. I'll say almost 50 to 60% of diabetics cannot achieve what you have achieved. So that's a big thing. So carbohydrates are very, very important for us. So we need carbohydrates. There's a whole gradient of carbohydrates. There are good carbohydrates and there are bad carbohydrates. So when you eat something that is absorbed slow, it goes all the ways down to the gut, and then the gut bacteria, it needs that carbohydrate. So if you're eating a sweet potato, if you're eating some complex grains and all, so they're all important. The problem is with the quick sugar, so which comes from either the white sugar, or it comes from anything in that form, or from the refined and ultra processed grains, which is a more common behavior than as compared to what you are showing. So those are the ones that get absorbed directly from the stomach, and they cause a raise, and they make the hypothalamus have that aha moment, and then you want it more and more. So it actually stimulates your appetite to have that same thing more and more. In other words, it becomes an addiction. In fact, of all the addictions, food addiction becomes the most difficult thing to handle because of this factor, is the glucose factor. Now, the plants have fiber. They don't have, in general, the fat. Most of them, if they have, it's a healthy fat. And even so some of those things have to be kept in mind. But it's the fiber that actually helps diabetes more than anything else. So when it goes all the way, the gut bacteria is producing anti-gluconeogenesis things and all, and that's what helps.
So I have a question on allergies. So Dr. Wani, you talked about allergies are developed with age, sometime adult, sometime late. And one of the things you talked about is by reducing the consumption, slowly growing it, you may get your body accustomed to it. Is that generally true, or it has to be treated one-on-one?
Yeah, so what you're referring to is that oral immunotherapy. And that's typically not an adult treatment. It's in kids that they do this. So for adults, if you find out you're allergic to something, the best thing is to avoid it. I don't think oral immunotherapy would work.
Namaste. My name is Vijay Kane, and a lot of what was discussed here, a lot of the answers lie in Ayurveda. Ayurveda is extremely strong on understanding gut health. If people understand the concept of Jatra Agni, a lot of these answers are there. Also allergies. And then another thing I want to mention, when you were talking about the nutrition content, there was a book I had read by a local doctor several years ago, and there was a chart in there. It was called ANDI. I don't know if anybody has ever heard about that. Aggregate Nutrient Density Index. It was a score from 0 to 1,000. And the highest score was for, I thought spinach was 1,000. It was about 700. There were 4. Kale was one of them. Mustard green, collard green, and watercress, which is used in Chinese cooking. So I just thought if we follow that chart, carrots were pretty low because high glycemic index and all that. So I thought paying attention to that. Also, I was talking to some people in the food science research departments in Texas A&M University. and I'm so glad you mentioned about growing things in your own backyard, because the nutrient content drops. The potency, after broccoli is harvested, within 24 hours, it has lost more than 50% of its potency. And so what we think is healthy and fresh, what percentage of the broccoli is actually giving you some nutrition. So the freshness of the foods and the farmer's market, I liked all those ideas. And unfortunately, they're not as easily accessible as we would like them to be.
Thank you so much. Yeah, that's a wonderful, point which you brought about. And believe me, kale is very easy to grow. Eat kale. I actually make kale parathas and they taste good.
I have a question. They say that the fruit, when you ingest, it has fructose and which can be easily digested and absorbed. So the sugar content is there and it increases your glucose. What do you say about that? Because you added a lot of sugar, fruits in your.
Fructose is as bad as, actually, it is more worse than the glucose because it's the different pathway it goes through. But so long as you're taking the whole fruit in moderation, it comes with fiber. So it basically delays the gastric emptying, goes to the right place. And so whenever you're taking, there is something called fructose fiber ratio of anything that we eat. And this applies more to the fruits, which is a better index than glycemic index that we usually talk about. So if they have fiber, good fiber, fruits have good fiber content. And then the fruits also, other than fructose, so fructose is definitely, you cannot have like too many fruits. You can have fruits, but then the thing is, say, for example, the really sweet fruit ones, and you have to take them in moderation, but then it comes with a lot of fiber also. That's an added benefit as compared to fruit juices. So if you have fruit juice, then you get all fructose. So that gives you a kick.
Okay, my another question is, brain, your endocrines and all these are made of fat, and they say fat also has more satiety factor. So you feel full eating less. So when you say that cut down your fat, how does that answer?
I'm going to answer that being an endocrinologist. There's something called good fats and bad fats. Now, good fats can come from your nuts, almonds, pistachios. Bad fats can come from frying, samosa, jalebi. So you have to pick your fats correctly. So, so it's really limiting the bad fats and eating small amounts of the good fat. So yes, fat is satisfying, but say for a snack, just want to go back to the gentleman who said that he improved his diabetes. I'd love to be your endocrinologist. A superb job. But say you can, so for a snack, if somebody chose a piece of cheese, a small cheese and some nuts, that's your good fat. You're adding a little protein to your fat. Whereas if you chose to eat our desi snacks, namkeens, that's your bad fat. So it's the right, picking the right fat also. Avocado is a good fat, but if eaten in too much, it becomes a bad fat. So it's moderation. I do want to mention something about the grains because the fact that you mentioned that you were on something called a glucose monitor and we see how your blood sugars go up and after you eat grains. Yes, I mean, I thank you for the wonderful talk, Dr. Anil and Dr. Ritu. Grains are good, but again, in moderation, especially for our diabetic population. We really do not need to include that in all our meals. Pick a meal without a grain too. Maybe your lunches can be just salad with some sort of a protein. Your breakfast can be, yogurt and a fruit. It doesn't have to be that all meals have to have a grain in them, because that is so true when we actually see how your blood sugars react after you eat the grains, they do spike up. So in moderation is the key. I do want to point out, Dr. Anil had said that 25% you can have your samosa and your jalebi. You cannot. You cannot. It is keep it to a moderation once in a while. What does once in a while mean? Maybe once a week, every 2 weeks, little bit, little portion, but not every day. Not every day.
That is true.
If you leave it up to me in my clinic, I would say once a year, but I'm not so mean. I'd say once in a while because we all are humans and I'm like that too. But it's really keeping it a small amount and once in a while. Okay. Yeah.
More so, probably this is true for people who already have chronic diseases.
Correct.
Say somebody has diabetes, yes, they have to be more moderate, in terms of choosing their food. But if they are on a healthy, because, other kind of foods which we are incorporating is very, very anti-inflammatory. So it is boosting our pancreas. It is producing all that insulin, helping us to bring down those sugars in many different ways. It's not just we are trying to stop the spikes of the sugar, but we're helping the whole system. So incorporating everything, that's why the concept is about the full plate. Plate should look very colorful, diversity of food, and obviously, if you have chronic condition, then limiting.
हाँ जी नमस्ते जी, मेरा नाम राकेश वर्मा है। ये एलर्जीज के बारे में आपने दूध और खानों के बारे में बात किया कि पहले दूध नेचुरल होता था, अब उसमें दवाइयाँ हैं, ये वो, उसके कारण बड़ा असर हुआ है, और ऐसे ही फूड के ऊपर भी। तो ये एलर्जीज के बारे में मेरा बड़ा एक जनरल सा सवाल है जाटों वाला कि हम वहाँ भारत से पैदा हुए हैं, मैं यहाँ पे आया हूँ, हमने कभी एलर्जी का नाम नहीं सुना था, कभी उसका कोई असर नहीं हुआ था। ओह सॉरी थैंक यू जी, थैंक यू। हाँ जी, कभी नहीं सुना था। मतलब आजकल भी सूरज वही है, हवा वही चल रही है, पशु पक्षी जीव जंतु पेड़ सब वही हैं, वो एलर्जी कहाँ से आ गई?
Yeah, no, that's a great point. And what I was trying to say is that even physicians don't understand. I mean, almost 50% of people develop food allergies, and we don't know if it's if it's genetics, is it the added ingredients, the hormones? We don't know, but it happens. Yeah. But this is this is like hearing loss, right? I mean, I see patients like, well, my dad never used a hearing aid. I'm like, well, he probably never got tested. That's why, So now we're getting tested, and so where people are more in tune to their health at this point. So.
जी नमस्ते जी, मेरा नाम रीता गुलाटी है। मेरा क्वेश्चन मेंटल हेल्थ के बारे में है। मेंटल हेल्थ अगर हम किसी को अगर नोटिस भी करते हैं तो उसको डील कैसे करें उससे, या खुद से भी अगर हम ग्रीविंग से गुजर रहे हैं या किसी भी चीज से, तो उसको डील इजीली कैसे उनको एक्सप्लेन करें, कंफर्ट कैसे करें?
My Hindi is not great, so I'm not going to try. But I want to make sure I understood what you're asking.
How to deal with it and how to help somebody with mental health.
Okay. Especially you said grieving, right? If someone is going through
grieving or separation anxiety. If somebody's like kids are away from the home and they go through that.
So how to cope? How do you? Are you asking how to help yourself or them?
Help myself or my child if somebody is dealing, if you see some signs of the
distress, right? It could be due to any reason.
Anything.
I would say first is acknowledging, hey, is this something that is in excess, right? Is knowing that, is this something that just comes and goes? Am I able to, eat my food, sleep okay? Am I able to show up to work? Is there any problem in different areas of my life? Is this upset causing me impairments in other areas of my life? So you want to first assess that, right? Second is lean into your support, which is why, that social component, right? Do you have a safe space? That doesn't mean you come and have a talk on to Arya Samaj, but you call your best friend or you call someone that you really truly trust, where you can confide in and say, hey, I'm just stressed about it. Let's say that talking doesn't help. After a while, you still are finding it hard to kind of get through it and you need some extra support. That is when I would say, again, if it's about navigating these life stress and it is not to the point where you are in the red zone, which is like you are in touch with reality, you are not having thoughts about dying, you're actually anxious, but it's significant enough that you still are able to function in some areas of your life, then I would say go to a therapist. And if nobody was going to ask me a question, I was going to ask a question to you in that, how do you know who to reach, right? Like who is the therapist? Because nobody wants to go to a therapist that doesn't look like them or even talk or understand the culture, Thankfully, like again, programs like REACH, they have resource list in there of South Asian American therapists. You don't need a medication to adjust to separation anxiety unless that anxiety is crippling and you can't function.
Sometimes you see signs of mental health in
Mhm.
young adults, but how do you approach them, or to say you need help, or how do we can
Good question.
directly go help them?
Good question. Especially when it's our kids, it's
Yeah.
a tricky situation too. They may have an opinion about parents and what we know, and may not always be open to talking to us about, especially if they are young adults or adolescents. So how do you approach them? I think first, getting them, not make a big deal in front of the whole family, but having a private conversation. Hey, I want to talk to you about this. I'm your mom, I'm your dad. This is not like you. Something doesn't seem okay. Are you all right? I want to check in with you. And many teenagers would say, I'm okay. Everything is okay, no problem. Because at that age, we've been through teenage years too. We don't quite listen to our parents at that time. We listen to our friends more. But when they kind of dismiss that, you kind of come up, hey, the other day I saw that you were sitting and crying, or I noticed that, your grades, you used to have no difficulty at school, and I am not pushing you to get good grades, but I just want to ask if you're okay. And if you're not, I want you to know that I love you. I'm there for you, and we can figure this out together, what to do about it. So just again, there's a limit to what you have control over. You cannot get into their head and know exactly why someone is behaving. You can make note of it, show care without judgment. Like, hey, you don't have any reason to be sad, or you need to study, we want you to have good grades. We want you to get into Stanford, whatever it is, right? Not judgment, not pressure, and I find myself sometimes doing the opposite. Like I would tell my kid, and my kids are young, but I would tell my daughter, just recently I told her, like, hey, you can do a better job than that, so obviously I was judgmental there. And she was like, Mom, don't try to make me perfect. I think don't try to make me perfect. And I'm like, she's 7 years old, and she said that to me. Of course, she's a psychologist's daughter, but that really put me back in my place. That I was like, I'm sorry, honey, that was not my intent to turn you into perfect or get perfect grades, but push yourself to what you can. You set a standard for you, and you're okay. You're right. And I kind of backed off from that, So again, alert, talk about, make space, offer that support. If you want to talk about it, I'm here. You cannot force someone to change. You can take the horse to the water. You cannot make them drink the water. Okay. So keep that in mind, especially with family. It's hard because you don't like to, you don't want them to suffer. And that's partly the problem, is allowing our kids, our generation, to experience disappointment, to experience boredom, experience frustration. We have not taught them, because many of us, including me, I've come here on my own, did hard work, got to where I am. So I don't want my kids to go through those things either. So I kind of expect high of them. And I want to protect them from harm. Be careful, don't do that. Whereas my parents, for lack of control, they just allowed me to take risk. I left the country, went into an unknown place. We all did, right? But we navigated those without much support. And so exposing our kids or the other younger generation, and even yourself, to be okay with being uncomfortable, so have hard conversations, because that's where growth comes in. So there's a don't ask, don't tell policy that we have. Many of us notice something is off, but we are like, oh, I'm not going to ask because he's going to, yell at me, or she's going to just say, well, roll her eyes at me, whatever it is, right? But make note of that and just make yourself available. That's all what you can do. And then, if they are willing, point them to, options like a therapist, by the way, the difference between there's a lot of names: counselor, therapist, psychologist. The difference is that a psychologist is a PhD level person, versus the master's level clinicians are therapists, who are much more trained to deal with the mild to moderate stressors, whereas psychologists are much more trained to deal with more severe, persistent as well. So just for understanding what these different titles are.
Well, thank you. Before we go to the next question, people didn't get introduced who's sitting here. So we have worked very hard to put a really good panel together. Dr. Nitin Mahajan is a cardiologist. He practices in Woodlands, right? Woodlands. Dr. Muralidharan is actually an Ayurvedic doctor. He is stationed at the Patanjali Wellness Center, available, I think, every day but Monday? Tuesday to Saturday, okay. And, he's an expert with that. He's been in our health fair last year too. Dr. Ritu and Anil Gotwalji, you heard them. I think they're both cardiologists, right? No. Internal medicine, he's a cardiologist. So there is a lot of medicine behind them. Dr. Manish Wani, you heard his speech. He's I can say, ENT is okay. Otolaryngologist, okay. Dr. Rahul Prakash is a nephrologist. Long time, he was the one who initiated the very first health fair right here. So he's gotten too busy these days, but thank you very much. Dr. Murpidi is also a cardiologist. Dr. Atul Gupta, our own alumni, is an internal medicine expert, family medicine. Beta, so nice to see you here. It's always a pleasure to see our alumni back here. Dr. Reshma Markan, as you know, is an endocrinologist, and you heard from Dr. Renu Thomas. So thank you very much. This event is an yearly event as we celebrate our Arya Samaj Sthapana Divas, the foundation day of Arya Samaj and Arya Samaj Houston. So be on the lookout for that. We had the EKG specialist here, which unfortunately not many people took advantage of. They were supported from Dr. Suneja and Dr. Pai's office, and they've been coming here year after year. This was the lowest performance in terms of usage. Usually we are short of time and we had to delay them. But anyway, those who took it can get their EKG read, and maybe I can request either Dr. Nitin Mahajan or Anilji to meet the patients now outside. Sanjay Nayarji has set up the booths. There is a last question. This session can continue. I'm not trying to disable anybody from here, but this is a very, very good session. And I want to thank all the doctors from the bottom of my heart. And thank everybody who's come here. Mental Health Initiative, the REACH group, everybody is here. And this is a very important initiative. Believe me, we don't want to see any more tragedies. Let's address it. So thank you very much. Go ahead.
Yes, this question is for Dr. Renu Thomas. My name is Purushottam Sahu, and I really enjoyed your talk, and I wish we had more speakers and more panels like the one you presented. My question is very simple on the biological origins of mental health. I read a lot about this stuff, especially schizophrenia, and can you elucidate on the new techniques they're working on, like gene therapy or MRI scans and stuff? Thank you.
Thank you. That is out of my expertise in some ways, but I can tell you some, there is trends, correct me, doctors here, the medical doctors, right? Like, there's definitely like therapy beyond just the prescription medications, there is transcranial magnetic stimulation, right? Vagus nerve stimulation for depression, extreme catatonic depression, so there are different upcoming, studies. But again, you have to think of it. A person doesn't exist in vacuum. A person doesn't exist just in their genes. It's in a context. So your context impacts your genes and vice versa. Your genes impact your context and your behaviors too. So having much more, in the holistic approach that I put up there is actually not holistic, because holistic would include spiritual, component too. And I didn't even have time to get into that, so it's capturing all these elements to treat someone, understanding that you as a person, me as a person, doesn't exist in vacuum, So I didn't quite answer your question about what are the upcoming things. There are, I'm sure, if any of the doctors are privy to this, like, what are some of the upcoming biological treatments? But I can talk about the psychological treatments, but but there definitely is, but again, treating it from multimodal as opposed to just one angle would be helpful with any illness. It could be schizophrenia, it could be depression.
Dr. Thomas, thank you very much. I think there are a couple of people who want to talk to you on one-to-one basis.
Thank you. You all are very brave. So thank you. I really appreciate that,
And now also, Dr. Prakash, Atul, Atul, yeah. And I think Dr. Markin. They can go and, there are people who want to know about the blood work and questions about that. The others can stay here and we can continue with any of these other questions people have. Okay.